You represent a pretty extraordinary combination of perspectives. You're here working with youth and adults. We have state corrections and local jails, community supervision, people across the court system and local law enforcement, people who have been incarcerated, crime victims, survivors, mentors, treatment providers, employment service providers. You represent really all of the different perspectives that need to come together in a community, in a county, or a state in order to do what it takes to reduce recidivism and improve success rates for people who've been incarcerated.
This conference is a great opportunity to bring states together. I think the science of what we do in corrections has evolved, but now our challenge is around implementation. So be able to share that with other states and talk about what's worked, what our successes are, challenges, and how we've overcome some of those is just a great opportunity.
60 different risk assessment tools.
We know that if you invest in community-based reentry programs, you prevent crime, you reduce prison costs, you improve public safety, you save taxpayer dollars. But more than that, we know it's the right thing to do.
They get to converse with people from around the country and find out what kinds of initiatives they have, what kind of programs they're trying to implement, getting to hear about the successes they've had, but they've also are getting to learn about the challenges that they've faced and how they've addressed those challenges, and everybody's walking away with lessons learned from that.
Had a chance to talk with someone from Portland who's doing an amazing mentoring program, and I think I'm going to have a video conference with him and some of our faith-based partners in Harlem because we're trying to do something in that area. It sounds like they've figured out how to do it well.
The grantees that are from the JMHCP conference and the SCA conference getting to meet one another is really great because what we know as TA providers is that many of them are actually facing similar issues. They're simply facing them through a different lens.
What I see is a lot of excitement and a lot of learning and a lot of networking. I see people talking about best practices, learning from other states, learning from our federal partners. So I see a real team approach dealing with reentry.
Subsidized wage, the program's paying the wage.
We have an overrepresentation of individuals with mental disorders and substance use disorders in our criminal justice settings. That's clear from the data presented already. Understanding how they got there can be an important component for designing interventions that mitigate their chances of returning there.
This is the first time we've really effectively, I think, presented this integration of looking at criminogenic risk and behavioral health need, and I honestly see that as one of the most important next steps in the field in terms of the work that we do in criminal justice.
6 million folks every year coming back into our communities, and we knew we had to do something to assist them in their adjustment in the community. And the Second Chance Act gave us that opportunity to fund local and state programs to better work with the offenders coming back into the community.
Is the whole mentoring aspect.
In all, the Second Chance Act has provided over $300 million in funding for grant programs that have served nearly 90,000 individuals.
The Second Chance Act and the work that you do sends a clear message to the millions of Americans who have been in prison. The message, we've not given up on you. We've not written you off.
And we hope to learn some things from you guys.
I have listened to so many of you speak about what it is you're doing and how you're engaged in this, what I consider to be a fight. The fact that I'm so joyous and I'm able to enjoy every little moment that I can is in great part because of the support network I have.
Never before have we had such robust discussion about offender reentry. Never before have we had our state correction system so focused on reducing recidivism. Never before have we seen so much positive work across our country that looks at the intersections of criminogenic and behavioral health risk factors.
I truly believe that years from now, people are going to look back at this time in history as a renaissance in criminal justice thinking.
I know what you're describing.
You're helping to provide hope and another chance for men and women across this country who are ready to turn their lives around, just need a little support.